For many in Ghana, bushmeat is not just a delicacy, it's a livelihood. It's a vital source of income and food for many people. The trade has long been an essential part of the local economy, providing sustenance to families and creating employment opportunities, especially for women.
I ain't fear bebre. Maybe it was 7, maybe 1969. My uncle school and to Ashubi. Into my family say maybe school no, na me pay trouble. And was starting say or the moanitino. But you travel me and na me di kojo ni makoton. Into efiri won matoni abepem send them to way. My year over 55 years.
My tongue remunam 30 years in it. Na me go school and me babeton. Me babeton na me mama nton bi na me di obi achi. Eti me di na chi na me jai school. Me mama kan ya ma go school. Na me di remunam achi sa. E di awo memunsia.
Efie dudu amaye adwuma dey say me wo 81 ti me fan say my adwuma be 40 years. Ekwa remunam adwuma dey aboa me bebrebe. If you say enu am na me tena ya na mawo memu 9. Ya say me fan say me ma na no bi ani Ghana ha. Nti adwuma we ni dey aboa me. Me japade okura me bi adwuma na ama mai.
Enye bidi enu asra me hwe me nkura. Every meeting time me year juma me year na me nyangware e ware ye na me kun free mu nsa juma ya na maya from tabre am so ye e na me dina hwe me mba na iti e juma kama
E do ba me kunu be wuja na me kita nkwala nson me ka jere kwa na wanya mfie mienu e juma ya e na me dia hwe nkwala na be from tabre nya me abre se mu na awie bese ye to hwe num kura kwa afi
entem ha obi kura twam na sabe ekom de no a yetim mani bi to aduane bi and at the same time importem afo no so obi so tumi ba no so aba be ye adwumani.
But the arrival of COVID-19 has severely disrupted this once thriving business. The COVID-19 pandemic significantly impacted the bushmeat trade in Ghana. Generally, the pandemic also disrupted the livelihoods of people dependent on the bushmeat trade. Many vendors and traders faced significant economic losses due to the restrictions and bans imposed on the trade. Additionally, the pandemic highlighted the risks associated with the bushmeat trade, including the potential for zoonotic disease transmission.
I mesia pa wo adwuma mu pa de betimi ameka say covid dey be buruku me kra because covid ne ba ye no that time we say adwuma oba tan na adwuma wo ye de pese ebe hwe afiri ho nti say o ska wo betimi ato bebre na why wholesale na de ye wo di freezer kese nti ya hodo bebre sisi wo bebre nti anka bi anhye me da sori esi bi di covid.
COVID ni die no kwasem ede ene de ya de bia mo boso kura na me raho because COVID no ebe ha ye especially me ni shak time COVID ni ba e kura ni kunu no ya no nya stay o ye driver ni etini ni fa problem mu pa bet ni nyina mu no nyame ye
o ha pati de egu adwuma no e ma kakra kra ye boa no no an ekodi ni nyina ye ntoma so yi ni nyina etone time ba ye ndi e kasa hame na me boa e ma me manu school kra ye basa
na bebre so e kasa e bia yare no ye e wo mu ni ade e ho na di problem da bebre no because no mu so say ibora ba e kasa ibora wo yare namu no come ba no mu say wo namu enso e na ni namu e de have bread and I'm tom for pa.
In Central and West Africa, including Ghana, bushmeat markets were affected by government measures to curb the spread of the virus, resulting in a substantial decrease in bushmeat sales and trade volumes. women faced social stigma and discrimination associated with the bushmeat trade, further exacerbating their challenges. The financial downturn made it difficult for many women to repay their loans, and a significant number of traders ceased selling bushmeat altogether due to the adverse economic conditions.
So the aim of the project was to understand how COVID-19 affected women in the bushmeat trade. And then we also wanted to understand how the social institutions and government structures impacted on the livelihoods and the health of the women, and use these findings to make recommendations for the future.
In fact, for me it was strange being a medical officer and public health physician specialist. So I was quite skeptical from the beginning. But I remember the famous phrase from John Slowdicki in his 14th Dartmouth address, when he said the worst troubles in the world comes from the hearts of men, and it's only through men that we can resolve them. So for me, it motivated me to know that regardless of my feelings about the project and how I feel about it, if I commit myself to it, I can get something out of this project for the betterment of society.
The Women Rise initiative, launched by the International Development Research Center in Canada, aims to support action-oriented and gender-transformative research that explores the intersection between women's health and their work, both paid and unpaid, in the context of preparedness, response, and recovery from COVID-19. The project, based in Ghana, is a collaboration between the Center for Biodiversity Conservation Research at the University of Ghana, York University, Memorial University, and the Ministry of Health Ghana, focuses on examining the socio-economic and health vulnerabilities of female bushmeat traders during and after the COVID-19 pandemic.
So the criteria for the site, we were looking at places where bushmeat had been traded for a very long time. So we selected Bupe, it's a known market for bushmeat. Techiman is also a known market. Apimunum in Kumasi is a known market. Kantamanto and Mankesim. We did surveys, focus group discussions, in-depth interviews and observations. We also did ethnographic studies. So 5 women were selected, and we had a research assistant following them for a period of 3 months, going to the markets with them, going to the farms with them. They followed them to churches and funerals. We did all of these because we wanted to have a total understanding of the lives of the women and how it is intertwined with their livelihoods.
Nanka make us and nanka was a medical abom abaso. Na mpanyimfo si refi na ukofa.
Some of the interventions the project has put in place for Atrimunum, the women were given coolers to put their meat in, and this protects the meat from any infections from flies. A new butchery was constructed for them. There was a challenge of clean water. So we have given them water to use for their businesses.
Because first no kurano, who say na ye soldier, na e free visi. E visi no kura timi koye, e wo ma ne wo mo ye adwuma. Etimu ko wo mu. Ye ne ye tie visi on se kosoro. Etimu fa ha nyina. Saa de ni nyina kura astop. Enu nti saa e ho no kwa kwa mebo mesem. Na me de ama mo se mo aya ade. To so o ma sidan kama de amaye. E say ye wo inside, ye use gas. Eni e de hu nam no. Ensuo to a emoye. Ewie ebo a enhye. Eno so e kama. Ye hu wi a ne asan e wo ma san si ba kwa e bie mu a. ɛhɔ no ne yɛkɔ wohoro nam no ho ɛyɛ hɔ kama ne yɛtwitwa ne yɛde aba outside ama obi so aba abɛtɔ bi ɛna at the same time so ɔmo asa ama yɛ ice chest a ɔmo me yɛde nam na agum sese wo ba ha koraa wobɛtumi adi adanseɛ sɛ first ne ɛnɛ ɛnsonsonya abɛm
titiri kura kooma a ɔmo de brɛ yɛ yɛme nhyira ne de ma wɔn yɛhunu wansa obi bɛtɔ wɔ bie kooma no so ama na hwɛ ana gyaal hɔ nso yɛtutum yɛyɛ yɛdwuma kama mehu sɛ de mesia ka ɔmo aboa yɛ papa anka ba yɛwisi obɛtumi atena sɛsi am no tie wisi ntima nyam fɛtena ɛnso sɛsi ɔmo brɛ yɛ ayɛ gas a yɛde yɛ adwuma si dama yɛde yɛ adwuma many anyam fɛtena wie dada
nti ade customers te abrɛ yɛ paa ɛna obi a ɔntɔ nam no koraa no bie no a obehu sɛ ɛho sitie no a ɛho te nti wɔtɔ obetumi atɔ bi
oh ice chest no koraa no aboa yɛ sɛ first no ne yɛtɔ blog paa sɛ wode nam 2 pan mu a sɛ wode blog gu so na blog na nane na ayɛ nsuo ɔmo aboa yɛ paa kyerɛ sɛ ɔmo ama yɛ adwuma na yɛ neat aboa yɛ paa na nka wei mu koraa ne da bi yɛde yɛ ano yɛ so yɛntimi nyɛ.
At Techiman, we realized that the smoking was hazardous to the women. They were using metal barrels to smoke the meat, and a lot of smoke that comes out affected their health and even the meat that they were selling. So we constructed a new oven for them to use to smoke the meat. And then the tables on which they sell new concrete tables were constructed for them.
Baby, probably feel when you know, you're there. We are. So I'm saying, but yes, I do with my why am I saying, it means I wanted to make for Kama. And the young Sakan, if I saw yet on the young first and Tefre, yet bring us in Tefre, but when I'm more about the baby, she tell me, so I'm some by your way, my I'm a Tefro, same crow, one of the wood hanging now, my
oh, obviously, there was a year my idea. A boy and pa because I must be back. I know. Ucha one ombre, and sucha one. Now I said, Yabin Benson. It says to the quantity them offer her, Ura. And I obviously know it's me fun your mother brave. First, by the uncle, no shenema crabia, Naima, but obviously it's mission in my pants, a year party, a bomber bus.
A real baby, no. The Agenani, a one number, and sure try a boy. A real boy, Jinum. How baby, an entrance in here. Na ye table nso na ye nnua se nso agya mu na ye ni anu kura na me dekeke se nso agya mu asesi a me gina ha me ho me nam eso sa first nso agya mu agya ni nyina timi dum na ye dadwo ne kase pa ma ye
empo omumpa monto ne nyama wa ha pampo ne kase ye dum e fede aye akondo obi kwa nto ne ma wa kwa so to pese o metin ha sei ko se ha ye kama.
Nyamu bebo ye de aboa ye bebre efi se first no ne ati awiam nsuo to ane yatim so to ane ya omo enam ne ba ne ya ye mobo bet se amu bebo ma ye de nsuo to ayete ase awie bo ayete ase enframa nso fa se fine nti ane de aboa ye pa
first na heat nso me ehu nyina mfefre si tantantan se ekọ me ehu nyina mfefre ti hwe ha.
The COVID-19 pandemic brought significant challenges. However, the resilience, strength, and adaptability of these sellers will be crucial in determining the future of the trade and its eventual recovery.
In fact, this project really has exposed me, because look at the world as it is now, in the world of unknown unknowns, and the fact that we need agility and flexibility. It made me know that this profession that has been there for a very long time was very neglected. Society didn't have an eyesight on it. And with all that I've seen through this project, I realize these women have to be protected their livelihoods have to be protected. And also with the dwindling stock of bushmeat, vis-a-vis all the climate change and health issues that are coming up, we need to see how we can also get bushmeat trade in different ways beyond even going into the forest. And also protecting those who are already in the trade, and look at the lean season when they should harvest the bushmeat and when they should also allow the stocks to replenish. I won't say surprised me, but I think one thing that hit me very hard during the stakeholder conversations was that when we're trying to encourage them to go into domestic production of bushmeat, they made it very clear to us that the taste of the domesticated one is different from the taste of the one in the bush. So it really brought to mind that we really need to think about how we can do more scientific research in terms of the nutrition in domesticated animals if we want to encourage a trade and encouraging some of our hunters to go into domestic production of bushmeat.
So through this project, we were able to bring all the bushmeat traders, including the men, to form an association. The association is very relevant because it gives bushmeat traders a voice to negotiate with the government in the event of a pandemic and also to get services from the government in the event of any emergency.
So I think clearly, I realize that some of our policies, we've not really gendered them well. And also the fact that some of our policies really didn't look at these women. But one major aspect of our research was to look at women empowerment. So clearly, one of the things we are doing is working with the Ministry of Gender. We've had stakeholder conversations with them, the Ministry of Trade, because these women, because they were not even known, they had no association. We are helping them as part of this project to even have a formal association. So we are working with the women of gender trade to have them registered, and then through that they can also have incentives when government want to support vulnerable women and women who need some kind of government support. For me, that's the exciting part of this project, that beyond the research, we are also going in to improve upon their livelihoods.
Significant efforts are still required to guarantee the long-term viability of the trade, and these women are requesting even more support.
Ebola no ne COVID ni ba no kwasem ebe broku ye. Enu nti de ye besre se animu kwa animu ye de. Ye besre mo. Mo ma ye sika kaka de be ye adwuma. Because aban bo sia no ye ne nsi ho no edoso. Nti de ye betu animu kase pa ne se mo mra na mo meboa ye.
Emna no kra no mo mpanimfo no ba mo ne ye kasa se ka insurance ne nyama insurance no ho se ma ye di dwade. Can shed and nim sa adieno. It's a commander with my so boy is Casemu Kakra. Nobody ever fancy him say, Via, insurance when the Yamamo, when Sicase and a mountain to a set a bay and bet me a cheers, Canamaya. And can you be higher at your banging?
Eh, they're delighted, Bem. And Sonoma illegal, it's a much free. In your meet a bemoir, name your light bemoir, a baboy, was a dreading renaissance in free anthem. The sunlight were high, baboy, and my name so it's me apples.
And one come on the baboy and care pepper, ye, Mumma, you freezer and ye. If you say freezer, no say you will freezer. And I'm going to buy your togu mood at the store, Namono.
Women in Ghana's informal bushmeat trade were already grappling with substantial socio-economic challenges before the pandemic. Despite their efforts to cope, they lacked adequate support from policies or organizations. Faced big socio-economic challenges before the pandemic.
So the key findings are that COVID-19 affected their income. It also affected their savings. Most of their goods got rotten. So a lot of them were in debt to the extent that some of them were even taken to the police station. They could not pay their debt. And it also affected how they took care of their families. We realized that the women didn't have any form of social capital. So when the COVID restrictions affected their businesses, some resorted to selling other things in order to survive. Some also engaged in other businesses to raise capital in order to come back into the business. COVID-19 also affected their mental health. there was no impact on their physical health, but their mental health was greatly affected. They had sleepless nights. Some of them developed BP, a condition they didn't have before the COVID-19. Some of them became very fearful about the future.
So the big challenge I see is mental health, and I will work with them, with the related organizations, Mental Health Authority, clinical psychologists, to help improve upon their mental health in their various places.
ɛno ara ne yɛde abɔ yɛ bra ahwɛ yɛ ma school ebi ma wɔ secondary school ebi ma wie university ebi de yɛ ma atu kwan ɛyɛ adwuma wɔ yɛ kakra na ayɛ na
adwuma no sɛ da kyɛ ɛyɛ kɛseɛ paa sɛ Nyankopɔn ma yɛ a yɛbɛyɛ yɛbɛkɔ ɛma nso bɛba so abɛtoa so
adwuma yi da kyɛ deɛ nokura ne Nyame anim sɛdeɛ yɛyɛ ba adwuma yi mu no na nam no sitie no ene ente saa first no ye ba adwuma mu ka no pa bebo no nsia na kwa bere ha nyina mo se we de na mo ba na we de na mo ba wo betimi atena fa ko wo beto number bru sa aduo no na ye elia mu ha ya ene nam no edan sisie ene proto atwitwa na ya ton no hama nam no ekọ akire ti ye nam no ne ye kọtọ na akire
o adwuma ne de ebekọ so mo kura mo be so yasene no mpodi ebekọ so emoa ne de enu ti na duru mire bi a ne yakurosu so ahụ ne yakurosu nam no na mo na nya kwan awo amana dọọso ne yasa bi amaye ti wo mu bi ma na mo na dọọso ye kunti we posome watwe bi na mo kurosu se de mo na be nya kwan awo.
So I would say that with the bushmeat trade, we realize that it is something that runs in families, generations, from grandmothers who handed over to mothers who have handed over to their own children and to their children's children. And so for a lot of the women, that is all that they know to do. They don't have other skills. So it is important that the government comes to their aid and help them in their business, because it is through the business that they take care of their households, their children, their husbands, and their dependents.
Amid the challenges, hope endures. In post-pandemic Ghana, the bushmeat trade stands at a crossroads. Communities, led by resilient women and projects like Women Rise, are forging a path toward economic and environmental balance. As new policies and grassroots innovation take root, this is no longer just a story of recovery. It's a movement toward equity, sustainability, and a reimagined future.